Hi, we're Group 4, and my name is Katie, and I'll be playing the speech-language pathologist.
My name's Renee, and I'll be playing the audiologist.
My name's Kayla, and I'll be playing the graduate student.
I'm Abby. I'm playing Miss Saunders. I'm a 62-year-old patient who just received a cochlear implant.
And I'm Mariana. I'll be playing her spouse, Mr. Saunders. Hey, Miss Saunders, how are you doing?
Good. How are you guys?
Good. It's nice to see you again.
How was your Christmas?
It was really good. Charles and I, we had a wonderful Christmas with our son. All the kids were there, lots of presents. It was a good time.
Awesome. I'm so glad to hear that. And how are you doing with your implant so far?
Good. Implantation was like only a couple weeks ago, so I'm still having a difficult time with the technology, getting used to that. The other week we were at Cracker Barrel, and it was really hard hearing Charles in that kind of environment. It's just all types of noisy environments are really hard right now.
Absolutely.
Recently we were at a family reunion and she got very upset because she couldn't hear the grandkids, and it was just a big mess, and we're just very upset because this process is getting us nowhere.
Absolutely. We understand that.
Definitely. So we're definitely going to work towards helping to make this better for you. Obviously, like you kind of mentioned, this technology is still really new for you, and so your brain is still adjusting to kind of this new way of being able to hear, and so that will take a little bit of time. So I would encourage you guys to just be patient with us, but we are going to go ahead and kind of start working on some communication strategies that we can implement that will also help kind of make communication and make hearing hopefully a little bit easier for you guys. And so kind of the first one that we're going to go over with you today is speech reading, which is a technique that we use with a lot of our cochlear implant patients and can be very successful with.
Okay, so you just want her to read lips all day?
No, so speech reading is a little bit different. Here on our cochlear implant team, our speech language pathologist, Katie, is really experienced with speech reading, so I'm going to have her explain a little bit more about that for you.
Okay, so like Dr. Harper was saying, this is Katie, our speech language pathologist, and she has a lot of experience with speech reading, so she's going to explain to you how it works. And before we get started, if you're unable to hear us at any point during our discussion, please let us know, and if you have any questions, don't hesitate to ask, okay? Katie?
Hi, so yeah, speech reading is just kind of being able to figure out what someone is saying by taking a lot of things into account, such as their lips, their facial expressions, their body language, and kind of the overall situational context. And these can kind of tell us how the message is being portrayed and what is being said, and can give us a lot more information beyond just the words. And it's pretty much like a visual strategy.
I just don't understand this whole process. You're making us just have her read lips all day?
I know this can be very frustrating. The whole cochlear implant journey is long, but this is a little bit different than just reading lips. So a lot of people can mix speech reading and lip reading, they think it's the same thing. But lip reading is kind of just focusing on the actual sounds and the words by looking at their lips, which is helpful to us and helpful to you. But speech reading relies on a lot more factors than just the lips for understanding like facial expressions and gestures and situational context.
Okay, that makes more sense.
So Kayla, would you like to give some more examples about that?
Yeah, sure. So like she was saying, you have to consider a lot more than just reading lips. So with gestures, you're going to be looking at the gestures people are making, so like nodding their head or pointing, beckoning, or just talking with your hands. That'll be very helpful, as well as people's facial expressions. So, you know, if they're smiling, they're usually in a happy mood. If they're frowning or their brows are furrowed, then they're usually mad or upset. And then the situational cues too. So, you know, when you came in today in the lobby, the lady at the front desk, like you knew what she was going to say to you. You kind of had an idea and you knew what you would say back. And then like when you're going to the doctor's office, you kind of have an idea of what they're going to ask you. What doctor are you seeing, your insurance, and you just kind of have that prepared in your head. So it's important wherever you are just to consider your environment. And yeah.
Well, yeah, and another example kind of is saying if you can't actually hear the intonation in someone's voice, you could take those things into account. So if they're saying like, oh, okay, like they're smiling and they're kind of nodding their head, you can tell that maybe they're in a happier mood and they're excited to do whatever you ask them to do. But if they're like, oh, okay, and frowning, and you can't hear them say that, but you can see that they're kind of slouched over and a sad face, and they're just, you know, overall just kind of sad, then maybe they just aren't that happy. So that's kind of another example of speech reading and taking everything into account and being to figure out what someone is saying.
So how can I help in this?
Absolutely. So since you are going to be the primary person that Ms. Saunders is communicating with along with your son, it really is important that we work as a team to help kind of facilitate these skills. And it's great that you have such an amazing support system, especially within your family, because those are the people that you're around most often from our prior conversations. And so that's very important within this process. And so a lot of times patients that we see with such a great support system like this have great success when their spouse and their children are also willing to kind of contribute to the oral rehabilitation process as well. So having hearing loss just in and of itself doesn't necessarily mean that you'll be great at speech reading or not good at speech reading. Speech reading is a skill, so it's something you develop over time. It's just like riding a bike. Practice makes perfect, right? So you kind of have to work at these skills, and you as a spouse, we would just want to make sure that you're also facilitating these skills at home. Make sure that she can see your face when you're speaking. Make sure that you are utilizing gestures and body language to help her understand, especially as we're kind of getting started on this journey. So that's all very important. And then, of course, with any sort of hearing loss, we see reduced understanding. And that's kind of the main thing we're trying to combat here. And so, of course, that's frustrating. So we are obviously trying to address that first and foremost with the cochlear implant. So that kind of addresses the auditory component. But then there's other ways that we can help, such as speech reading, kind of ways to supplement that and fill in those gaps where we may still have them.
Okay, I think I can go home and tell the family about this to help along in the process.
Well, yeah, like it's been a very long process, like you've just said, like myself, Charles, our son, we've been struggling with this for the past couple years, and I'm really excited to take on a new strategy to just be able to communicate with them better.
Absolutely.
And I am really excited about this process, but it does seem like it can be very tiring and difficult.
I know this is a long journey, but don't worry, these skills are going to help you in the long run. And you might have some difficulty at first, but kind of take those opportunities as learning lessons. And you can kind of compare this to riding a bike. So it's going to be hard at first, but once you master it, it will be like second language to you. And speech reading is kind of just like that. And just remember that motivation leads to faster progress.
Honey, just think about the grandkids. You're going to be able to have story time and playtime with them again.
So before you leave today, I wanted to give you this brochure. It has a little bit more information on speech reading and a lot of sources that you can use. There's a lot of websites and DVDs you can buy. I think some of these websites are actually free, so if you want to check that out, these are great tools you can use to start practicing and building your skills. And there's a little bit more information of other speech reading approaches such as eye training and brain training, and we'll touch on that in a later session. But you know, just go home and look over this and see what you think, and we can discuss it more next time.
So I think that was a great session. I think right now just go home and try to focus on these skills and try and hone in on like the gestures and facial expressions and just kind of a team effort and just see how it works, and then you can come back next week and we can talk about it and see how it went, and yeah.
Dive on in.
Good.
That was great. It was good to see you guys today.
Yeah,
Thank you so much. It was really nice meeting you.
Likewise.